With us today is candidate for Florida House District 3. That's most of Santa Rosa County and the northern portion of Okaloosa County. His name is Jamie Wells, and he's one of two candidates on the Republican side that you'll be able to vote for in an upcoming primary, which I understand is not completely decided when that's going to be just yet.
That's right. That's the crazy part.
But whenever it happens, he plans to be on the ballot. So, Mr. Wells, can you tell us a little bit about yourself and why you've decided to run for this state house seat?
Absolutely. And thank you, Chris, for the time. We appreciate it. My name is Jamie Wells. Like you said, I'm a 24-year Army veteran. Spent my career in the infantry and ranger community, 4 deployments to Iraq. I got out. I work with veterans, helping in the local community with a nonprofit. And when this election came up, I was asked to run. And I said, we need a patriot, not a politician in the House. And if I could run and make this, attainable for our folks in the district, and I got people behind me, that I would run. And so that's what we're doing.
And so tell us a little bit about where you stand on your policy. What are you looking to do or help push across the line, things like that you want to see done in the state house if you were to win election over the next 2 years?
Absolutely. So my first and foremost thing that I would put together is a task force who want to go and either work with or fight against the insurance to make insurance attainable and accessible for our folks not priced out of their houses. Right now, the insurance is on a climb, and we're limited and hands are tied on what we're able to do about it. Folks are losing either their homes or pricing out of their homes. And so we want to go after that and find a way to put a control measure on that so that that doesn't continue to climb and escalate. The second thing that I'm interested in is I'm for construction and growth for Northwest Florida. However, what we are failing to do is matching the infrastructure along with the growth. And so I want to make sure that plans are in place, assessed, and funding is available to improve those infrastructures as we move on.
So I'll take these one at a time. So the first one that we want to talk about is insurance. You said you wanted to put together would you say it's kind of a working group to come up with ideas? Is that the idea?
Right, like a task force, if you think of a working group, a group of professionals, specifically folks that have been in the insurance business and finance, to look at that to help come up with a solution. But what I believe is, truthfully, if we work together, there is a way to come to an agreement where both the insurance is successful, but also the folks are not continuing to be, like I said, just be rated over the coals and priced out of their home.
Do you think there's a place in the market for a state subsidized option? Is that something that you would look into or consider?
I would look into it. Again, I'd rely on a panel of experts to help me in those decisions to make sure that the decisions we're making is not putting us in another financial situation that we're not, the economy's not prepared for.
Looking also at the construction and growth that you talked about a little bit earlier, do you feel it's the state's job to bring in funding for that infrastructure? Would you say that, I guess, how would you run that? How would you make sure that the people that need whatever money they need are able to get that money for roads and bridges and stormwater and whatever it might be?
Right. Well, some of it obviously relies on within the counties and the commissioners, but there is parts that are a state responsibility or state are able to step in and assist with, and that's where I would want to come in. Work with the local board of county commissioners. Work with the city councils to see, okay, this is your parameters. This is what you're responsible for. Where can the state step in to help in our district, right, and across the state? Because infrastructure for our district is what I'm concerned about, but it's across the panhandle. I know, for an example, here in Milton, an area where they've just got 9,000 homes approved, they're going to get built, but the roadways aren't there. So where are those 9 or 10,000 cars going? Where are those kids going to school? Where's the hospital that's going to support that? And so just looking at that, both, at the state and federal level, where we're bringing that funding and the millions that we use on other resources, how do we pull that in here to help in the local area?
Looking at the way that you guys are going to go ahead and have to fund these projects, right, in the long term, as a guy that's looking at the cost of maintenance for these projects, how would you continue to pay for maintenance once these roads are built?
Right. So again, being new into this situation, those are things we'd have to look into. We would obviously have experts that are not only working with me and working with us, but oversight that's going to be the ones that approve that. Obviously, I wouldn't be able to approve that specifically by myself. It'd have to go through the House. And then the same for, at the federal level, that funding would have to be released and brought down for us.
What else do you want people to know about your campaign? Those are two really important pieces, right? Insurance and construction and growth. What other planks of your platform are you telling people about as you go around District 3 earning votes?
Right. So one of the things that I'd also like to do in District 3 specifically, that is veteran related, is we'd like to see a level B station put up here somewhere where we could utilize that for our local veterans, Pace, Milton, Navarre, and across the district. Because what's happening right now, Pensacola VA is 140% overstrength. So it could take 3, 4, 8 months to get an appointment. If we had a local...
Excuse me for interrupting. I just don't know what a level B is. Can you kind of explain that concept?
Right. So if you think in common terms, if you think of almost like sorry, I lost my train of thought. If you think of like an urgent care or a facility like that we go to here locally, but for veterans. So your pharmacies, your X-rays, your common sniffles, appointments like that, you need possibly having a counselor in there for counseling, a full-time VSO. So if we had that there locally, that would save time, money, and resources for our local community and the district. But what it would also do there at the Pensacola VA would free up appointments that they could now make that might not take 3, 6, 8 months to get an appointment.
Okay.
And so that's one more. Another topic that I'm looking at specifically when it comes to the mental health piece, both military and civilian, when it comes community-wide, is I look at our law enforcement and our veterans and first responders, right? I know right now for law enforcement, there's really only 2 main programs that they have for mental health. Right. One is a peer-to-peer program. They also have an online or another system that they use. But most of the help, what I'm being told from most of law enforcement, is down south. I would like to see more funding and more attention put into that. And what I'm trying to work here to speak with the local sheriff and the police chief for our district is to see about mandating mental health counseling. What I'm proposing is right now, when I talk to most of the deputies, it's the same thing. Those programs are there, but they don't want to utilize them because they don't want the stigma of having an issue or possibly risking their job. So if we mandated that, this service is provided, but, whether it's every 2 weeks or once a month, that every service member, every officer has to go through that. They could go through and you wouldn't know. Am I going because I actually need it, or am I only going because it was a mandated meeting? But while they're there, they could share their resources, share with their information that they need, and get the mental help they need, rather than dealing with it on their own or not getting help until it's too late. And then we have the crises that we sometimes we see that could have been avoided if they had had that attention at first.
How would you fund that kind of program?
Right. So the biggest thing with funding, and again, being new to this process, there's funding out there and there's different pools for different things, right? So we reach into those pools that are provided or may have already been approved but not allocated, and we ask a request for those. There's other things that we would simply have to write into the budget to propose, and then it obviously it gets approved or disapproved. But there's funding out there, especially in the mental health aspect. It's how it's articulated and how we pull a request for those funds. But I mean, there's no denying it. There's a mental health crisis across the U.S. period, let alone here in our district or in Florida. So there's a need, and normally when there's a need, you're able to find the funds if you get the folks behind you.
Speaking of need, especially here in Okaloosa County, we're kind of coming into an affordability crisis when it comes to housing. Have you kind of looked into the issues that we have, and in Santa Rosa County for that matter, when it comes to affordability and just being able to find a place that, you don't have to spend half your paycheck to cover? Is that something on your radar?
I mean, obviously, affordable housing is important. It's not specifically in my top 5 of what I'm looking at, but I do know that when I talk to folks, and I'll use the communities here that are being built, when these some of these residents are coming, or some of these neighborhoods that are being built, they come in, they say we're building simple starter homes for the American family. Well, I can tell you, I live in a neighborhood that's like that, and a simple starter home for an 18 to 25-year-old should not be $330,000, right? So, I mean, there's definitely room for improvement there. What I could do at the state, at the state level, that would have to be looked at. But that's a bigger problem than just the district.
Absolutely. Well, those are all my questions, but I want to give you a last opportunity to speak directly to everybody out there in social media land and on our website. What do you want people to know about you, and can you give them kind of your elevator pitch for why you're the guy for District 3?
Absolutely. First, I'll start by saying I'm a patriot, not a politician. I believe a blue-collar guy can go in there that's with the people that go through the same issues and the problems that they see every day and can make change and work for the people. The second thing I say is I spent 25 of my 51 years in the military serving our country. Now I want to serve the people. And what I say that is because I'm not doing this as a career. My career is over and complete. I'm only doing this now to help the people. If you put somebody else in that office, they're climbing their career, they're still building their career. That means they have to toe the line. When someone says, if you want to move up or advance, you need to do these things, they're going to have to do that if they want to advance. I'm there for the people. As long as you want me there, I'm there working for you, but I can't be swayed or bribed. The other thing is I'm not personally a large business or own several parts of land that I'm going to benefit from. I'm simply doing this for the people. So, I think that's a good standing point. I think my standing point on being a normal person and our slogan, the people's voice, the people's choice, it says just that. I work for you. And some people that have been in office forget that. And I think that's important for the people to know.
Jamie Wells is a candidate for District 3's upcoming, but not determined, election. The primary, of course, will take place first. And if there is a general election, that will happen after the primary. So stay tuned for election dates in District 3 if you live in all of Santa Rosa County, with the exception of Gulf Breeze and the northern reaches of Okaloosa County. So everything pretty much above I-10 with the exception of the urban area and Crestview. This is your election coming up. And of course, we'll have more here on midbaynews.com as it comes up. Thank you so much, sir, for joining us today.
Thanks for your time, Chris. I appreciate it.
Yes, sir.